better advised to focus more of your efforts on trying to, conquer the basic problem of poverty and malnutrition rather than focusing on developing more and more sophisticated hospitals with their amazing surgical abilities.
Steve, I would like you to understand that the economy of the world of the 21st century will be driven by healthcare industry. 20th century was driven by machines which address the human toil. Today, healthcare industry is $4.5 trillion. US healthcare alone is $2.5 trillion. This is the industry which is going to drive the world economy. You invest on the healthcare, you're going to make country wealthy and healthy. You look at NHS.
But you speak as a private operator, and I come back to this word profit. I mean, again, would it not be better if the Indian state were delivering, without the profit motive involved, were delivering the sorts of services to people that you're delivering? At the moment, the Indian state isn't doing it, but maybe you should be pressuring it to do much more.
The state can provide healthcare with taxpayers' money. Taxpayers' money cannot offer healthcare in any part of the world. Even in the developed world, forget about developing world. Taxpayers' money could pay for healthcare at a time when people retired at the age of 60 and they died at the age of 65. Today, people retire at the age of 60 and they celebrate 95th birthday.
Well, so this is an ideology for you. You do not believe in state-delivered healthcare, whether it be in the United Kingdom with our National Health Service or in India. You don't believe that model can work anymore.
It can't work anymore because cost of healthcare is too high. People have to pay a tiny amount of money every month for the healthcare. We are trying to convince the government that
well, you say a tiny amount of money. It isn't a tiny amount of money, is it? I mean, if you're a very poor farmer, even 22 cents a month, which you described, is actually a major commitment. There are millions and millions of Indians who simply cannot afford to pay any health insurance at all.
No, 22 cents, a packet of BD, that's a local cigarette, costs more than 22 cents. So all we are trying to say is that one day you don't smoke, with that money, you pay the insurance. I'll tell you, Steve, we have 750 million Indians spending 150 rupees per month just to speak on the mobile phone. And all we need is 10 rupees out of that. And we have the best the health system in the world.
Why is it then, if this private model works so well, that in the United States we see more than 40 million citizens who cannot afford private health insurance? I think many Americans would listen to you extolling the virtues of private health care for India and scratch their heads and say, well, it doesn't even work in the richest country on earth.
The cost of healthcare, cost of doing anything on the human body is the highest in United States of America. You cross just the border and go to Canada. The medicines, the same medicine made by an American company is available at half the price in Canada.
Sure, but the Canadian government forks out a huge amount of money to maintain its healthcare system. I believe 10% of all Canadian GDP is devoted to healthcare.
All I am trying to say is that all across the world, there is a serious problem in delivering healthcare. This is the only industry where 70% of the cost goes for the salaries. You ask any businessman, any industry, is there any other industry where 70%, 75% of the revenue goes for the salaries? No business will be sustainable. So there is something seriously wrong with the way healthcare is run in England, in the US, and in Asia. We have to take a stock of the situation because this is the next disaster waiting to happen. Today there is nobody questions because people have no money. Once that problem is addressed, then you realize there is something else is a problem, that is a shortage of manpower.
Okay, so let's just discuss how far you think you can take your model of healthcare. You want to build medical cities, as I think you call them, in different parts of your own nation, and then it seems you have an ambition to take that model and take it overseas. I mean, how far do you think this can go?
Our intention is to build hospitals in India, in Asia, in Africa. When I reach 60, I would like to spend a lot of my time in Africa because that is one area which is very close to our heart, and we believe that Africans do not need money. They need institutions to train doctors, nurses and medical technicians. Then they can take care of themselves. So essentially our intention is to build a large number of hospitals in these areas.
Well, I find that fascinating. I think many people listening to this will find it admirable. But if that is your commitment, why, at the moment, as far as I can see, is so much of your time and effort going into building a huge hospital complex in the Cayman Islands?
We would like to show to the most influential country in the world, that is the America, that just outside their water, you can build a hospital and offer healthcare at less than half of what it costs in the US.
So that is very explicitly about, I think, what people now call medical tourism, is it? You're
Yes.
going to get a hospital offshore from the United States, it has to be said, in a tax haven, which I'm sure you're quite pleased about.
Yes.
And you are going to appeal to Americans to come to you for cheaper healthcare than they can get in a US hospital.
Exactly. I mean, my target is not American population. We are primarily looking at the Caribbean region, because in that region there is no large hospitals, and we are looking at Latin America, Canada, of course the US patients.
It just brings me back, Dr. Shetty, to this idea, the first question I asked you about whether you're first and foremost businessman or doctor. I mean, if you really do want to push your model into Africa and deliver to people who've never been able to afford healthcare the sorts of hospital treatment that you're now trying to deliver in India, why on earth are you spending so much time and money on a project in the Cayman Islands?
Because we have large number of, there are partners from US who are very willing to partner with us in Cayman Island.
Yeah, but that's because they see a buck to be made. I mean, let's face it,
Yes,
US healthcare is
I
all
agree.
about the profit motive.
Exactly.
But you say you're not about the profit motive.
Yeah.
So why are you mixing with these people?
The people who are going to partner with us are running a very prestigious not-for-profit hospital chains. They are not companies which are listed and the profit motive. We never tie up with that kind of entities. Our intention is we want to start the first project there to convince everyone that it is doable, and hopefully, God willing, if everything works out fine, then roll out a larger hospital chain in Africa.
I dare say a lot of people watching this will wonder how quickly you can deliver. One thing that strikes me is that you need to train, or you need to see a system which trains vast numbers of new doctors. India needs hundreds of thousands of new doctors. Africa would need them too if it were to reach the sorts of levels of healthcare that you've imagined. Who is going to train all these doctors?
One of the, when I decided to come here today, I have already finished meetings with several policymakers in England. We desperately requires a global university, Steve, which would train doctors, nurses and technicians in India, in Africa and Latin American countries. The traditional university system of medical education can never produce sufficient number of doctors. So there are, UK is one country which can bring about this major transformation, because UK universities are respected all over Asia and Africa. And your degree is recognized by all these governments.
So it will have to be government in the end, because of course the government is still heavily involved in funding of UK universities. It'll have to be governments and state spending that trains the doctors, if not runs the hospitals.
Exactly. All we need is the curriculum and the examination system, and everything else can be taken care in India, Africa and other countries. We desperately require a global university which has accreditation from US university.
And in a word, you confident that your kids and your grandkids will live in an India where everybody has access to decent healthcare?
Yes, India will become the first country in the world to dissociate healthcare from affluence. We can show in less than 10 years that you don't need to be a rich country to offer healthcare to everyone.
Devi Shetty, thank you very much for being on HARDTalk.
Thank you. Thank you very much, Steve.
Thanks.